Hi viewers, so welcome back to our channel. So today we will be discussing about our core testing, which is that we are focus more toward reproductive genetics. So today we will just explain a little bit that what is reproductive genetics and which areas it covers basically. So there are two main areas to reproductive genetics, that is identify risks for inheritable conditions, that can be any disease or syndromes related to genetics that can be identified, and so basically reproductive genetics helps patients helping couples to understand the chances of passing on genetic disorders or any genetic condition to their next generation. So basically this is the main area which reproductive genetic focuses on. And the second thing is understanding abnormalities during pregnancy. So these are the two main, or you can say that it's the core identification process, or you can say the diagnosis purpose, or the purpose for the reproductive genetics is to these two. But that can be further divided into four sub criteria, which we personally say that it's the most important thing, that is genetic counseling. Because a lot of the time there are certain conditions in which the genetic counseling is needed, which we provided. Even we receive a lot of questions from different hospitals, even directly from people as well, who are curious to know about these things. So we provide those services for genetic counseling, so that they can understand better their condition, that what options they have and how they can go about it. The second thing is like preconception screening, like before pregnancy the couple wanted to know that what are the chances of them having any disorder that can be passed on, or maybe they are at risk, or either their family is at risk on, or if they have consanguinity. Because a lot of time we receive patients, the doctor just asks them, are you contiguous couple, means like cousin marriage or out of family marriage. But actually the patient a lot of time don't know that are what does that mean, what are the issues associated with it. So we try to make them understand that these are the issues. So reproductive genetics help them sort out the issues that can be identified that are associated with the consanguinity. Or the third important subcategory is the prenatal screening and diagnosis. So a lot of time in during natural pregnancy, the couple wanted to know the fetal chromosomal fetal status, that either they possess any risk of any abnormality like Down syndrome, Edward, Klinefelter, a lot of others as well. Or sometimes they have abnormal ultrasound, but just for confirmation they wanted to know that they have to take any medical decision regarding that. So are their decision the right just on based off ultrasound, or they want to test the fetus. So this is another important subcategory of the prenatal screening, or you can say the reproductive genetic and diagnosis as well. So basically we can screen all sort of genetic disorders, chromosomal, and sometimes we just receive that the patient wanted to know the gender. That's still a debatable thing. We will have another video regarding that as well, just to see the ethical issues circulating all those things. But that can be checked during the prenatal screening. And the last most important thing regarding reproductive genetics, that it revolves around the preventive procedure. Like if we receive a patient, the major question is that yes, I had previous children. Unfortunately they had some muscular dystrophies, or either they had thalassemia, or either any inherited condition. So what's next? So that's the most important thing is, so reproductive genetics can offer them the preventive procedure, which we call pre-implantation genetic testing. It completely depends upon their condition, which condition they wanted to prevent, or either they are preventable, or either they are in future symptomatic treatment. So these are basically the two main criterias as we discussed: identifying the risk for inheritable conditions, or either understanding the abnormalities in pregnancy, which can be subdivided into the genetic counseling, which we mainly focus on, because that's the patient need to understand that with what they are going through, and what options are available for them, and what they can do about the conditions which exist in the family. And then is the prenatal screening, and then there is the preventive procedure. So thank you guys for watching. If you have any question, please leave a comment so we can get back to you and answer your queries regarding it. Thank you for watching our video.